So for the structure of the nails are composed of same epithelium as the skin, is keratinized epithelium, stratified squamous cells. And in the nails we have the broad part that is called the plate, and we have underneath the skin that we call the cuticle, we have the nail root. So just as the hair, we have there series of cells, stem cells, that allow the nails to grow. So that's the nail matrix. And on the sides of the nails, we have foldings, and these foldings, which are the lateral folds, protects the edges of the nail plate. Now, we also have a proximal and medial nail folds that are located proximally and distally, and the medial nail fold will be connected into the skin by a membrane. And this membrane, which is called hyponychium, sometimes we cut it when we cut so much our nails, and that is what it hurts. But just as the hair, our nails are made out of dead keratinocytes. If we weren't that way, every time that you cut your nails, it would be ouch, 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 or you cut your hair, okay? So we have dead keratinocytes. Now, next to the nail base, we have a half-moon shape. Sometimes it's visible, sometimes it's not, because it can be just under the skin. But if it's visible, it's called lunula. Lunula because it looks like a moon shape. And then in this area, we have actually the matrix a little bit deeper into this area, proximally, and this is where we have the stem cells. So functions, it is to protect our fingers from damage, injury when we are grabbing objects. As well, they help to enhance fine touch and manipulation of objects. That's the function of the nails. So this is a superior or top view of the nail. This is a sagittal section, showing you even the bones that we have. So this is the lunula. This is the nail plate. This is the cuticle, which is known as eponychium. In this side view, you can see the hyponychium that connects the free edge of the nail to the skin. And then here we have, depending on the finger we have on the side, so we have the medial fold, and this is the lateral fold that protects the lateral edges of the nail plate. And then here in this region, this is where we have the nail matrix that makes our nails to grow, and this is the root of the nail plate, just underneath this proximal nail fold. And something that we have here within this area, it is blood vessels, capillaries, that help us to see indirectly the oxygenation levels of the person. You will do one exercise that is called capillary fill time in AMP2, in which you will compress your nail bed capillaries and then release and see how long it takes for the blood supply to return. So indirectly, we can measure oxygen levels within this area. Now let's look at the other structures of the integumentary system, the glands. So the glands are exocrine glands, so these are glands that secrete their secretion into the surface of the skin, and they include the sweat glands. Sweat glands produces sweat, and these glands can be subdivided into two types. The majority of them, which are eccrine glands, it helps to regulate the body temperature. So these glands, once they release the sweat, it helps to basically drop the body temperature when it's hot. The other type of glands are the apocrine glands. These ones, they don't have their own duct, while the eccrine glands, they have their own duct. These glands, the apocrine, they release their sweat into the duct of the sebaceous glands. And they are located only in specific areas, like, for instance, the armpits, the groin area, and they are active during puberty or after puberty. Now, for the sebaceous glands, they secrete this sebum that lubricates our skin, and they are connected through their duct into the hair, the root of the hair, so that you will have the sebum going through this pore that allows the shaft of the hair to go into our skin, and then you will have lubrication of the skin. Now, these lipids that form the sebum are acidic, like the fatty acids that these lipids have helps to inhibit the growth of bacteria, because most bacteria, they don't like to have an acidic environment to grow. We have other glands, like the ceruminous glands, that we have them here at the entrance of the ear canal. These ones produce a sebum as well. It's a little bit thicker than the one that goes into our skin. And this sebum, just like as the sebaceous gland sebum, what it does, it helps to inhibit also bacterial growth, and as well helps to prevent debris from going deep into your ear canal, or even some insects to going into our ear canal. A modified sweat gland will be the mammary gland. Mammary gland, it is active during lactation in females, and this one produces milk. We will see more characteristics of this mammary gland during reproductive system chapter. So those are the types and functions of the skin glands. So we have sweat glands, sebaceous glands, and specialized glands. Now, in the sweat, we will have the majority of the components will be water, but also we can have waste products like urea, uric acid. We can have as well ions like sodium, potassium, calcium, depending on what is the composition of the blood in your body. And in a way, I don't know if you have experienced it, but if you have done exercise that is very strenuous and the sweat goes through your forehead and then goes to your corner of your mouth and then a little bit to your mouth, sometimes it tastes salty because it contains also these ions that we have, like sodium chloride, etc. So this is how the skin glands look like and then where they are located. So here we have an eccrine sweat gland. So this one, as I told you before, it has its own sweat pore and its own duct. So this one drains directly into the skin, and no matter which gland it is, they are located within the dermis, reticular dermis. And then the sebaceous glands, they are located around the root of the hair. So this is the root of the hair. And then they release their sebum through their duct into the base of the shaft here, and then the shaft and the skin will be lubricated. Now the apocrine sweat glands, which are these, they are a little bit deeper than the eccrine sweat glands. These ones, they drain into the skin using the duct of the sebaceous glands. So here is how they look. So if you magnify one of these eccrine glands, so you will see that they are made out of this simple cuboidal epithelium. And then they are called eccrine because they release their sweat by little vesicles, exocytosis of these vesicles. And then some of them, they undergo merocrine secretion. Now, these apocrine sweat glands, they are also merocrine. So if you remember, merocrine is basically shedding larger vesicles than eccrine glands. And holocrine glands, like in the case of these sebaceous glands, they rupture and they release their contents completely, and then they get replaced. And these ones, again, they are embedded nearby this area where we have these hair shafts, or well, the root of the hair. So, one question. Do we have sebaceous glands, oily glands in our palms and in our feet? And look at this picture. Look at where they are located. The sebaceous glands, this. So do we have them here and there? No, why not? We don't have hair, thankfully. Otherwise we'll be Chewbacca's. Okay, so now how does the integumentary system helps to maintain homeostasis? Well, one is by helping us to regulate body temperature. So if it's too cold, the blood vessels within the skin will constrict, they will shrink, they will become smaller, and then we have less blood supply, so that we maintain that body temperature in areas where we need it, like the core of our body, in the abdominal and thoracic cavities. If it's too hot, we have enlargement of these blood vessels, which is called vasodilation, so we have more blood flow, we dissipate heat. And that way, our enzymes in our body will have the normal temperature. They function as they're supposed to. Another one is by helping us to conserve water. Because we have several cells, and we have this keratin that forms a seal, we don't lose water as much. Most of the times we don't live in a humid environment. So we live in dry areas. And the tendency of our body will be to evaporate the water that we have. So we don't do that because we have the skin that acts as a physical barrier. And also help us to prevent infections. If you have an intact skin, if you don't have any wound, microorganisms, they don't likely invade your body. Now, if you have a wound, of course, you have to wash it really well and take care of it, cover it to prevent microorganisms from getting in. And then we have interaction with the nervous and cardiovascular system that help us to maintain homeostasis in a way, because let's say that you are cooking, you put like a cast iron skillet in the stove, and then the handle, you leave to do something, and then you come back, and then you start pouring the food, but you forgot that you leave the stove on, and the handle of this hot pan is hot. So what will happen if you touch it? You will feel pain, right? Because you have receptors in your skin that tells you that temperature. If you didn't have these receptors, you'll be holding that handle of the pan and it will burn indefinitely. So we have receptors in our skin also, part of the nervous system, that help us to maintain homeostasis. So this is the cycle of thermoregulation during high temperature. A stimulus is having a body temperature greater than 37 degrees Celsius, so greater than 99 Fahrenheit. So that is going to stimulate some receptors in an area of the body that is called the hypothalamus. That's where, in the brain, that's where we have the thermoregulatory center. And this thermoregulatory center senses that the body temperature is high, and it will send a signal to the skin blood vessels through the sympathetic system, so that the sympathetic system has less activation of the muscles in our blood vessels, so that these muscles relax in the blood vessels, and then you have expansion of these blood vessels, vasodilation, and then more blood flow going in an opening, a wider opening in your blood vessels. That will dissipate the heat, and as well, you will have some behavioral changes. Like if you are wearing a sweater or double top, you will remove that so that you can dissipate more heat. That's part of the behavioral changes. And then once you reach the normal temperature, which is between 36.1, 37 degrees Celsius, you will stop that cycle, that negative feedback mechanism. In lower temperature, if your temperature in your body drops below 36.1 Fahrenheit or 36.1 Celsius or 97 Fahrenheit, you will send a signal through these sensory receptors that we have in the skin into the thermoregulatory center that is going to activate your sympathetic system so that your blood vessels narrow down, so they vasoconstrict, you have less blood supply to the skin, you don't have any loss of heat through the skin, and as well, you will activate contraction of your skeletal muscles so that you can generate heat. You start shivering. And behavioral changes. If you feel cold, you grab something to put on so that you don't lose as much heat. And then once you have normal body temperature, that cycle stops. So that's the thermoregulation during lower temperature. So changes in the skin that can lead to problems. Lack of homeostasis. Well, you can have burns, and depending on the burn, it's going to be the severity of the damage. We have 3 major classifications for skin burns: first, second, and third degree. Third degree is much severe than the first degree. First degree is only in the superficial layer, in the epidermis. Second degree goes into the dermis. Third degree can go beyond the dermis. Third degree, you will have loss of hair. And at least in that area, since you will be destroying the receptor for pain, you won't have pain. But third degree, it is so severe, depending on how much area in your body you have affected, that you can end up in the hospital. Well, you have to be treated in the hospital. And you can lose many fluid that you need to have restoration of this fluid. And then you will be isolated in a room where they filtrate the air so that you don't have infection of your wound. And then they give the appropriate ointments, etc. So now another disruption, blisters. So blisters is basically a structural disruption between the epidermis and the dermis. Second degree burns causes blisters. These blisters can be filled with fluid, like pus in the case of bacterial infections, like viruses in case of viral infections. Certain viral infections can cause little pustules or blisters. Another disruption of the skin homeostasis is cancers. You can have squamous cell carcinoma, which is basically made out of the most superficial layers of the skin. You can have basal cell carcinoma that affects the stem cells in the stratum basale. You can have melanoma that affects the melanocytes in your skin. Some are more aggressive than others. Melanoma as a whole is very aggressive cancer. By the time that they find it, sometimes it's too late. So here we have examples of the three types of burns. So we have here first degree burn that only affects this layer. Second degree affects epidermis and dermis. And third degree affects up to where? It can go up to the hypodermis or beyond. So we have a way to measure the extent of this damage in burns. This is called the rule of nines. This is used for third degree burns. So this is a method to estimate the surface area of the skin that is affected. And the body is divided into regions that represents approximately 9% or multiples of 9%. And this is for adults. The purpose is to give a quick estimate of the burn size and to predict the outcome, to give a prognosis. So burns that involves total body surface area, TBSA, greater than 20%, or critical areas of the body like the face, the hands, the feet, the perineum, require definitely burn care center hospitalization. So here is the rule of nines in adults. The head, the anterior part is 4.5%, posterior part is 4.5%. Total, 9%, the entire head. The torso, anteriorly is 18%, back is 18%, and it goes up to the buttocks here. The arm, it is 4.5% front and 4.5% back. Perineum is 1%, the central area of our genital area, 9% for the legs, the lower limbs. Now in children, that percentage changes a little bit because they have shorter torso, bigger head in general. But there is a specialized formula also for children. So for skin cancer, what are the major types of skin cancer? So we have BCC, basal cell carcinoma. Originates in the basal cells of the stratum basale. It's fairly common, especially in someone who exposes so much to sunlight and in specific areas of the body, like our superior surface of our ears, the dorsum of our bridge of the nose, and also the forehead. But also can happen anywhere that you have a lot of exposure to the sun, like the arms. And then this is, again, the most common type of skin cancer. It looks like nodules with a central crater. That's characteristic. And then this one, thankfully, although it's the most common, rarely metastasizes. What is metastasis? Does someone know?
Spreading.
Spreading of the cancer. It's highly treatable with surgical removal. SCC, squamous cell carcinoma, arises from the stratum spinosum, keratinocytes in the stratum spinosum. The stratum corneum will not give you cancer. Why is this? But why in the stratum spinosum you can, but not in the stratum corneum? What is a major difference between these two layers of the epidermis? Why there is no stratum corneum carcinoma? What is the stratum corneum made of? What is the stratum corneum made of? Dead skin cells. Can dead skin cells give you carcinoma? No. But in the stratum spinosum, we have still highly mitotic rate in this stratum spinosum, these alive cells. So that's why you have cancer cells derived from this area. So this is the second most common type of cancer, and it looks like scaly plaques that can ulcerate and bleed. Look at the places where they can be found, head and neck. And this one is most likely to metastasize than the previous one, but still with surgery and catching it on time, it has good prognosis. Now for melanoma, we have different types, but in general, it is called malignant melanoma because this is the one that is very likely to metastasize. So this derives from the melanocytes that are located in the stratum basale. And when someone detects it earlier, he will have good chances of survival. So treatment will be surgery, radiation, and chemotherapy, which is common for many types of cancer. And then if someone has a mole, a birthmark, he has to check with these marks with A, B, C, D, E rule. So he has to check for asymmetry. So if this birthmark or this mole, it is asymmetric, well, better check it out that it is not melanoma. If the borders are regular, make sure that it doesn't change to irregular, like jagged edges. If there is color variation, check it as well. If the color is uniform, more than likely there's no problem, but that you have to correlate with all of these. And then if the diameter changes, so it becomes larger than 6 millimeters, which is a little bit like this, that size, also check it, and also check for changes in shape and in color, especially in areas that are exposed to the sun. But it can happen anywhere, even it can happen in the feet, guys. And you might be a person that always uses closed-toed shoes, so check it, and no matter what. So what are the risk factors? UV radiation is a major risk factor, including tanning. So UV, what it does, it changes the DNA. So you will have sometimes what is called thymine dimers. Remember adenine base pairs with thymine? So in this case, you have two thymines binding together. That's what UV light can do. Other factors will be chemical carcinogens. Or can be alcohol. It can be occupational. Maybe someone who works with let's say fluids like fuel, and the person doesn't wear gloves, paints. Another chemical carcinogen that can give you cancer anywhere is smoking. I don't know if vaping, I'm guessing that it will. Genetic predisposition, there are families where they have greater chances to have cancers. Immunosuppression, your immune system is not working pretty well. And then protective measures, use sunscreen, avoid excessive sun exposure, and have regular skin checks. So this is how this type of cancer look like. Basal cell carcinoma is like a nodule with a little crater here. Squamous cell carcinoma, this is like the type that it looks flat, but it has an ulcerated area that it can bleed. And this is a melanoma. It has differences in color, irregular borders, and large diameter. So clinical application, burn care and skin cancer. So you have to recognize the classification of the burn by assessing the depth and the extent, and then give the appropriate treatment. Early detection and treatment of skin cancer improves outcomes. And exposure to UV light and carcinogens increases the risk of cancer, smoking, drinking as well. Another clinical application, acne. So this is an inflammation of the skin, specifically the sebaceous glands, because there are microorganisms that can penetrate into these ducts and inflammate and infect these sebaceous glands. Hyperhidrosis is excessive sweating. Someone might have a lot of outcome of this sympathetic system, and then it will sweat a lot. And then tissue repair for the skin involves regeneration or fibrosis. Remember, regeneration is repairing cells with the same type of cells. Fibrosis is just with collagen fibers repairing. So that can lead you to having a scar. Okay, so in the next chapter, we're going to see the structure of the bones. So it's the skeletal system chapter. We're going to see the formation of bones, growth of bones, classification of the bones, the names of the bones, and the roles in supporting, protecting, storing minerals, and producing blood cells. Test your knowledge questions. I think I'm going to assign these specific questions. Which skin layer contains blood vessels and nerve endings?
was where blood circulation.
Which skin layer has blood vessels and nerve endings again?
Oh, I got it wrong.
Which one it is? Try it again.
Hypodermis? I'm not sure.
Hypodermis is not a skin layer, right? Epidermis is epithelium. Basement membrane, it doesn't have blood vessels. So then so if it's not basement membrane, if it's not epidermis, and if it's not hypodermis, is the? Mm-hmm.
I said that. She did say that.
Okay. Number 2, sebaceous glands primarily function to lubricate skin and hair. True or false? Thick skin contains hair follicles. I just saw yawning, but I didn't hear what was this. Number 2, melanocytes produce melanin that protects against UV damage. True or false? True. Number 3, the hypodermis contains mostly adipose tissue. Don't even do this because it's true. Short answer, how does the integumentary system regulate body temperature? Through sweating, and what else?
Decrease or increase blood flow.
Decrease or increase blood flow. When you increase blood flow, do you drop the body temperature or you increase it?
It's high, you'll help decrease.
You decrease it. And when you reduce the blood flow, you increase your body temperature.